Good evening, everybody. Welcome to All of Us Health Education Series. My name is Edwin Maldonado, and I'm the Community Engagement Manager for the All of Us Research Program here at the Medical College of Wisconsin. We want to welcome everyone to tonight's presentation, which is sponsored by the All of Us Research Program along with the Arthritis Foundation. The All of Us Research Program is a historic effort to collect and study data from 1 million or more people living in the United States. And the goal of this program is to better the health for all of us and advancing precision and personalized medicine through research. Like I mentioned before, tonight's topic is arthritis, and a couple of just quick housekeeping items. Number one, the presentation will be in two parts. The first part will be the disease overview. We will be talking about arthritis. And then the second part will be a Q&A section where you'll be able to type your questions to the chat box or hold them for the Q&A section. At any time you want to type in a question you might think of, feel free to put it in the chat box. We will be monitoring at our end and writing those down. So when the session comes for Q&A, you'll have a choice of either verbalizing the question yourself, or we will ask it for you. Again, this presentation is being recorded, and the recording will be made available on social media through YouTube, Facebook, Twitter, and Instagram. You have been muted by the host, so please stay on mute unless speaking or if we ask you to unmute. At the end, we will be doing a drawing for $25, and hopefully, good luck to everybody. Be part of it. Again, this presentation is being sponsored along with Arthritis Foundation. Tonight's speaker is Dr. Taraneh Mehrani, a rheumatologist with the Ascension Medical Group, and she'll be talking about arthritis and setting and communicating goals. Dr. Mehrani, welcome tonight, and the show is yours.
Thank you so much, Edwin and Taquanda, for having us here tonight, and all of you that are attending tonight. Thank you for your time, and I definitely want this to be interactive. This is for you, so if you think of anything along the way, just like Edwin said, just drop it in the chat box, and at the end, I want you to keep your thinking caps on because we're talking about you and setting your goals for treatment of your arthritis. So, I wasn't sure how many of you on tonight have arthritis or know somebody, if you don't have it yourself, you might know somebody impacted by it, whether it's a family member or a friend. And as we know, the pain and the fatigue are some of the top concerns that a lot of my patients bring to me in terms of their arthritis. So it can negatively impact many aspects of our lives, work, production, daily routine, just participating in a social activity, leisure activity, and then also emotional being, like losing self-confidence and feeling detached and isolated. But you don't have to feel that way because there's 54 million people in the US living with arthritis, and 300,000 of them are children. And sorry, Edwin, could you please advance off of my face? Thank you so much. So we do treat, when we say arthritis, what exactly are we talking about? It's a term that represents more than 100 diseases that affect joints. So in rheumatology, we treat over 100 conditions, and it basically, when you think about it, there are many forms of arthritis, but there are some that are not even that obvious to us on a daily basis, where you have some carpal tunnel syndrome, and it really might just be that your wrist is swollen and it's pressing on your your carpal tunnels here, and your nerve under here is pressing on there. It might be a sign that you might have arthritis. Or lupus, which is it's a very it can mean different things to different people, but skin, joints, sensitivity to the sun, and then joint swelling. Lyme disease and other viruses and things we think do trigger autoimmune diseases, and that can actually trigger your body to attack the joints. And psoriatic arthritis. So there's a form of a rash, as some of you may know, called psoriasis, and it causes kind of flakiness and redness to the skin on maybe the elbows and the knees. And about 30%, 1 in 3 people with psoriasis can have psoriatic arthritis. So they can have swelling in their joints and pain. Next slide, please. So we Yes, yes, perfect. Thank you very much, Edwin. So the two forms of arthritis, just to kind of break it up in general terms, is when I'm speaking to my patients and they're telling me their story, and their story is the most important thing to me, more than labs, more than anything else, is I'm thinking about, is this an inflammatory arthritis or a non-inflammatory arthritis? And so the most common type of inflammatory arthritis would be rheumatoid arthritis. And people typically wake up with a lot of stiffness in the joints because they feel the stiffness settles in when you're inactive. So 30 minutes or more stiffness in the morning, and fatigue can be a big part of it because it is a systemic illness. It makes you feel like you have the flu, but you're not really sick, but you kind of feel like tired and achy. And then the non-inflammatory form, which is, we call it age-related arthritis, as as we get older, or we've had injury to our knee or back or something like that over time, we might start having more and more back pain, just kind of mechanical pain. As we walk, the more we do, the more it hurts. So if, regardless of the type of pain you're having, and even if it doesn't quite fit that category, nerve pain or fibromyalgia and other types, we still encourage you to, bring this up to your doctor for a referral to rheumatology, because I don't think I've ever refused a rheumatology consult, because you just don't know what you're going to be getting until you actually speak with the patient. So next slide, please. So as we touched on, over 50 million Americans have arthritis, and it's definitely not just an old person's disease. Unfortunately, there are many children that have arthritis, and 1 in 3 working age adults with arthritis experience some work limitations. Next slide, please. So we want to kind of make this a kind of a proactive kind of thing where if you have arthritis, we want you to set meaningful goals and actually make an action plan to achieve them. And this can help you get back to doing the things you love to do. And I always tell my patients, you're your number one advocate. You have to be able to just, don't be shy, just let us know what it is. Everything's relevant. If you don't say it, we can't help. And if you feel like you cannot communicate with one, ask to go to another. But either way, you know your body the best. So your goals will be determined by yourself, and those are all going to be different for different people. Next slide, please. So a nice way to achieve the goals that you set for yourself is to, of course, share them with your doctor, and you could review them and recommend steps to take toward achieving them. And whatever that may be, exercising more, changing your medications. Let's just say you feel like you're so tired taking 12 drugs. Well, you don't want to stop them yourself. You want to bring it up that, you know what, I feel like I'm kind of zonked out on these medications and I'm still in a bunch of pain. So something's not working for me, right? And then, you can both come up with a treatment plan that incorporates your goals that help you feel better emotionally and physically. Next slide, please. So the Arthritis Foundation has a very nice mnemonic, and it's called setting a SMART goal. And I'm going to quiz you at the end for this one, but no, I'm just kidding. So SMART is an acronym for what you can do to set your own goals for yourself and actually make them more achievable. The S stands for specific. So if you have a direction that you're going to go in, it just makes it easier to achieve. It says exactly what you want to accomplish. M is for measurable. So, you want to be able to keep a record of your progress. Say your goal is to walk, 10 minutes 3 times a week, and you're only able to do 5 minutes. So you write it down and you measure it so that when you get to your 10, you can celebrate and you say, hey, I'm achieved my goal. And that goes to achievable. You want something that's not impossible, but also a little bit expanding your boundaries, right? So you're stretching yourself a little bit, not, you know, I'm never gonna say I want to run a marathon. I don't think maybe I did want to do that back in my youth, but you know, achievable goal might be, you know, a 1 mile walk or 5K or whatever you know you feel like you want to achieve. And again, R would be relevant. So relevant it's something that matters to you. So achieving it will prove you're a strong, independent person you know you can be. And again, to everyone, it will be something different. So, and then the final one is time bound, which means you want to set a time period where you want to achieve that goal by. So that you can actually say, okay, you can work toward that with certain time periods and dates. So what I wanted to do is kind of, yes, I can touch on that. But as I talk, I want you to think about, you know, all goals are not created equal. And you know, your goal may be different from someone else's, but one of the fun ones that I saw, and actually it was on the Arthritis Foundation website, was some examples. And one of them was, say you want to prepare Thanksgiving dinner for your family, right? So, you know, as an example of a not so smart goal would be just saying, I just want to cook more. And then, you know, you would have to think about how are you going to get there? So you think about the smart way to do it is you might want to say, I want to cook 3 homemade dinners every week for the next 6 months. So then I can work towards cooking my family Thanksgiving dinner, you know, for example. So you have these concrete steps. All right, so this slide just touches on how there are different types of goals, and they're both related. So you have the medical goals where you're focusing on improving your numbers, say like your inflammatory tests or your tender and swollen joints when you go in for an exam. But then you have your personal goals, and again, that's determined by you. And you should make those clear to your provider and that you agree on them. So I mean, I treat rheumatoid arthritis mostly in my clinic. Like I said, it's the #1 condition we have in rheumatology. And you know, I remember I've been in my current job for a few years, and I have a lady that just came in and she just said it to me. She didn't care about all these numbers and diagnosis, nothing. She was just like, I just want to be able to care for my 2-year-old grandson when he gets dropped off, and I want to play my golf. So whenever, you know, in Wisconsin, it's a big thing. When it warms up, everyone's got to be outdoors. And she was set on, you know, I got to play my golf. And so, you know, when we started her medication, I would ask her at every visit, I'm like, so, you know, what's going on with the grandson? Are you able to chase him around like you need to? And you know, are you going to play golf? And there were, you know, there would be some seasons where she couldn't play as much because she was either tired or sensitive to the sun, or her joints were swollen, her hips hurt. And then we would modify what we were doing. So next slide, please. And I would, again, encourage you all, if you can, to, in the chat box or at the end, you know, if anyone would love to share their goal, you know, it always helps others when we can kind of come up with something and share our ideas. Some of the other ones that I, you know, aside from the one I mentioned from my patient, maybe, you know, you want to take your grandchildren to the park. You want to go on a day trip with your friends. You want to sign up for the Arthritis Foundation walk on June 19th. Or you want to, you know, take the lead on a new project at work. So, you know, there are different goals, and you just want to think about how can you specifically write it out in a sentence so that you can try to go forth and achieve it for yourselves. Next slide, please. So this is pretty exciting. I was just actually informed of this. Vim is a tool that's coming for the smartphones And it's basically a tool that that helps you set your goals, and it's coming soon. So I think there's another slide after that where it kind of touches on here. If you want to take a look, it says basically take Vim, what pain has taken away from you, and receive support and guidance towards achieving your small wins. So there's basically support, and you know, especially now with the online world. And Sarah, you are here, right? Thank you. Sarah's our executive director at Arthritis Foundation.
Got a little bit new executive director. Yep.
Okay. Yes,
Yeah,
and
so
she is all over this app. Please, Sarah, go ahead.
well, it's still new, so it's officially launching in June. But I think if you search your app store, you will be able to find it. And as you were saying, you basically can set a goal, and based on whatever your goal might be, we have resources that will kind of feed back to you that might help you. So the example would be what you said, maybe being able to walk for 10 minutes, 3 times a week, or, whatever, some kind of motion, moving, walking goal. We have a Walk with Ease program. So we have different programs, different resources that, based on your goal, we might push out to you to say, hey, if this helps you reach your goal, if it might be a diet related goal, or, and in, trying to find a more inflammatory reducing diet. We have some diet tools for people. So based on what you enter into the goal, there will be resources that will kind of feed back to you. So sort of kind of that between meeting with your healthcare provider, we can then kind of supplement and help you try to meet your goal as well. So that's kind of the short of it. And again, launching more like publicly soon, but since we were having this tonight, I wanted to just kind of put it out there. I think you can find it, like I said, but you should be hopefully hearing more about it in the next, 2 to 3 weeks. So thanks.
Cool. Thank you so much, Sarah. That sounds like a fabulous tool, and everyone's on these social media and apps and everything there, and Arthritis Foundation is advancing to the 21st century. That's great, because I don't know if I have, so so we are thankful for that. Next slide, please. And along the same lines with Arthritis Foundation, there is a, this is right here, if you go to arthritis.org/insights, there's a survey that people with arthritis, we encourage you to put in your 2 cents, because this information, it's a survey where you can help us or help the researchers understand what are your top concerns for your pain, and what are the things that you need to help manage your arthritis better. So the survey has I think I was reading over 18,000 respondents right now, and sadly enough, 100% of them said that they're in pain, and 67% of them have said that they had to alter their activity. They couldn't participate in an activity that they wanted because of their pain. So, that feedback is very important, because we're here for you, and we really do have to, if we have all of these fabulous expensive drugs, but we don't have the means to get them to you, or, educate people on what rheumatology is, what arthritis is, then we need to know those gaps.
And
Sarah, is there anything you wanted to add?
Yeah, I was just going to add to that based on the first results, because the Insights has been going on for a while, it is over 20,000 now. And based on the first 20,000, what the statistics you had stated are absolutely correct, in that, pain is a major, hindrance for, obviously. I mean, we knew that, right? But it was very profound that, that it affects daily life. at a really high percentage. And that is what actually spurred our goal setting app, because it is based on helping people achieve things that pain has, made them not able to do. So, it's the results from this survey that people tell us help us with our programs. So, and it helps people with arthritis. So anyone that is, we did it. So that was just all that I wanted to add, Dr. Mehrani.
No, very cool. Sarah, I also saw that there was a pediatric survey.
Yes, so now there is also a JA version of the Insights. So Insights, the way that that you're reading it on the screen is for adults, and then there's the arthritis.org JA Insights for kiddos, I believe, ages like 5 through 18, I believe.
Yes.
It's actually, yeah, it's based on parent answers to that, but it's giving us some great insights into juvenile arthritis as well. So yes, there are two versions of the survey and of it. We are trying to, hear from everyone, and right now we have a lot of, like as you were stating, the different arthritis, osteo, probably where we with all types of arthritis, and to be able to, better see a full picture of arthritis in our community. So the more people that take it, the more we can help. We appreciate all the leaders.
Thank you, Sarah, for all your hard work with Arthritis Foundation in Wisconsin. We appreciate you. And so, yeah, this next slide is basically the helpline for Arthritis Foundation. So if anyone wants to jot that down, it's a helpline at arthritis.org or 1-800-283-7800. And it looks like there's some resources also for COVID-19, but I refer pretty much every patient in my practice with arthritis to arthritis.org, because what you find on Google is very scary sometimes, and it's always how you're going to die and how we're trying to kill you with our medications. So I always say, go to arthritis.org, please. Read about, what, you might be able to identify with what you're reading there. And also, Sarah, do we still have the downloadable PDFs on like diet, nutrition, exercise, all the different drugs that we use, and those educational things?
Yes.
Okay. All right, very good. Next slide, please. And here are some other resources listed here for all of you social media savvy people: Twitter, Facebook, Instagram, even Pinterest and LinkedIn. So I think we can keep that up for a minute, just in case anyone wants to jot it down, Edwin. Thank you. So as we're finishing up here, I just wanted to, I'm kind of glad that we kind of went through the SMART goals, but I would love to hear from any of you about your personal experience, if you have arthritis, if you know someone with arthritis, and if there's a goal that you'd like to achieve, and you can just kind of throw it out there, and we can maybe try to work through it kind of and make it a SMART goal.
So at this moment, what we're going to do is, if you have any questions, please go ahead and put it in the chat or in the Q&A section. If you want to ask the question personally, let me know either through chat. Let me know you have a question. I'll unmute your mic. And the reason I don't want to unmute the mic is I don't know what kind of sounds are coming from everywhere, and also we'll have a barrage of sounds. But if you do want to ask a question personally, please feel free to do so. Just let us know and we'll unmute your mic so you can, or I think you'll be able to unmute your mic yourself. If you can't, feel free to do so. So while we're waiting for that to happen, I have a quick question for here, Doctor. Had a few questions that came in a little earlier. What can we do for now to limit or lessen the pain while we're waiting for a medical appointment?
Okay, so it depends on where the pain is and what it is. So we always encourage you to only do as much as you can do, right? But it is good to move because contrary to some beliefs is, actually moving and walking and doing some sort of exercise, even if it's not weight-bearing exercise, let's just say swimming. That is actually more helpful for your arthritis and the inflammation and the stiffness that you're having. And then try to, and fatigue is sometimes a big part of it, right? So you want to do activities where maybe in the morning you'll decide like, today, this is going to be my main goal. My main goal is going to be just hanging out with my family. And then you're not thinking about, I have to go to the grocery store and do all these other errands. So you'll have less fatigue. And then, of course, there's over-the-counter remedies and things like that too that I'm not sure how much I can comment on, but there's, for the right person, acetaminophen, there's heating pads, some, sleep with your heating pads, and it's good to have. Some people like massage, some people like other complementary medicine is what I would call it. And there's nothing wrong with that. Physical therapist can show you safe ways to move your body. Like I said, I'm not sure if you want to let me know what kind of arthritis you're dealing with. I can kind of specify. For instance, if it's the knee, you're going to want to do quad strengthening. So a stationary bike or a regular bike to strengthen your quadriceps muscles can take some of the pain off force off the knees. And also, for anyone who's overweight, the studies in women, especially at Hopkins, have shown that even an 11-pound weight loss can decrease the force on the knees by up to 50%. So that's a big thing. So there are a lot of lifestyle modifications that we can do. And, we don't always, doctors aren't always the best ones for you to talk about all this nutrition experts and, other things, but a nutritionist would be a good place as well.
Great. Thank you. Thank you.
You're
I have,
welcome.
have a question here from seems to be a younger person or someone with a child. Does playing sports at an early age increase your chance of developing arthritis?
So generally, we don't think that that activity is going to worsen your joints. Activity is good for our joints. It's good for our bone health. It keeps us from losing our bone mass. But yes, if you have an injury, let's say, for instance, you tore your meniscus or something playing basketball, or you broke your wrist falling, during a sport, then the arthritis can settle in more in those joints later on in life.
Okay, great. Another question here regarding the VIM app. Instead of 6-week goals, are we able to make smaller goals with the app?
I believe so. Sarah, could you clarify on that one?
I might have to look at that. I believe so. Boy, and I can, Edwin, I can get back to you fully.
Sure.
Like it's a little premature that we announced it because it's a little bit new.
Sure.
But I believe that is sort of the starting point, was a 6-week.
Okay.
But I can't imagine that there wouldn't be a way to modify that within the app. So I can try to get you some more information that you can be push out. But stay tuned. So
Sounds great. Sounds great.
And they
Okay.
also say that to form, don't they say like to form a habit, it sometimes takes like a minimum of 4 weeks. I wonder how they came
Yeah.
up with the 6,
Yeah. Okay, I have a
good
question
point.
here from I have another question from a participant. I had a knee replacement that wasn't very successful. Still have pain due to arthritis. Besides having a surgical redo and PT, what else would you suggest?
So I'm not sure why the knee replacement failed. However, sometimes, like I was discussing earlier, is sometimes there's more than one form of arthritis, right? So it's hard for me to tell you specifically, but I have seen people that have had fusion of their spine and they end up having an inflammatory back pain, for instance, and their SI joints are fused and they're still having a ton of pain. It's because the arthritis was never degenerative to begin with, right? And you know, educating yourselves is the most important thing. It's like, okay, I want a second opinion on this. I feel like this is more than just my one spot, right? So if you find that you are having other areas that have, you know, inflammation, if you feel like there's swelling or warmth or stiffness, that might be something else. And then the pain may not be even joint, right? So it could be, you know, nerve pain or some other source of pain. But definitely check back with your orthopedic and let them know. That's the main thing. That's where you have to start, is with the orthopedic who did the surgery. And then once that's all checked out, then they can refer you to the right person, whether it's a physical therapist or a rheumatologist or somebody else. But good luck.
Great, thank you.
Good question.
Yep. Another question, are there any gender differences related to who tends to be more susceptible in getting arthritis?
Yes, so you know, as poor females, you know, we tend to have a higher risk of having arthritis in certain forms. So for instance, with lupus, it's a 9-to-1 female to male. With rheumatoid arthritis, it is more predominant female to male, but not as big of a ratio, very small ratio. And you know, osteoarthritis, also female, you know, more female predominant, but you know, we think about ankylosing spondylitis and psoriatic arthritis, so other forms of inflammatory arthritis, even gout. And gout can, you know, cause trouble. It's basically crystals that uric acid that builds up in your body, and we all clear uric acid through our kidneys. But after menopause, men and women are equal. So before menopause, you don't actually see gout in females mostly. So it depends. And hormones do play a very big influence in our autoimmune diseases. And they don't in so much in osteoarthritis. So again, it goes back to, it depends on the type of arthritis you have, and either way, male, female, you know, seek a consult, and again, you know, you know your body the best, so you know, you can tell them everything that's going on along with your joint pain.
Great. Can arthritis be hereditary?
Absolutely, great question. So you know, it's interesting. Autoimmune diseases, we always say they do have a big genetic component, and so it's genetics and environment. So even if you have twins, one of them may not actually, you know, with rheumatoid arthritis, one of them may have it, one of them may not. But definitely big genetic influence in our autoimmune diseases. So it's genetics and environment. In the hands, for the regular age-related arthritis, if your parents had or have age-related arthritis in the hands, you do have a more genetic component risk of getting it. So you can thank your parents for that. Thanks, Mom.
Really? All right. And can arthritis affect any major organs in your body?
Absolutely. So these are all very great questions. So not osteoarthritis, so not your age-related wear and tear kind of thing. I hate saying wear and tear, but just to kind of distinguish it from the kind that as we age, we kind of have our cartilage wears down and things like that. But the other types, the autoimmune inflammatory ones, we call them systemic diseases, and that means that it can affect your entire system. You know, your inflammation tests go up in your blood work. It makes you feel like you're sick, you know, and tired. And yes, it can affect insides. So for instance, psoriatic arthritis. People can have that rash, psoriasis, and then have the arthritis, but it can also, the inflammation can attack the eye and cause uveitis, so inflammation in the eye or inflammation in the gut. like Crohn's or ulcerative colitis, or even just inflammation. It doesn't have to be that serious. So yes, everything can kind of be related, and that's why I love being a rheumatologist, because it's like detective work, right? So I sit there and I'm listening to your story, and I'm trying to put it all together, and that's what makes it, is that, you know, you can try to, you know, it's not just one finger that hurts, it's a whole system, that you're a whole person. So we have to listen to the whole story. And also, I always ask, what brings you here? Because what you were referred for and what you might care about are maybe two different things.
Good point. Good point. Now, I want to ask a personal question. When I was a kid, when I was always snapping my thumbs or my knuckles, I was always told, "Stop doing that. You're going to get arthritis." Is that true, or does that have anything to do with it?
No, you're not guilty. You're not guilty. Does not increase your risk for arthritis.
Okay. Okay. Good.
You got to
So,
pass on that one.
so okay. Parents, don't tell that to your kids. No. Okay. Sounds great. Well, one question, another one I have, since all of us is part of in precision medicine, I've noticed too lately that there's been some breakthroughs in rheumatoid arthritis with precision medicine. Can you share a little bit about how that happened or what's going on?
Oh, fascinating stuff. So already, you know, I feel like I mean, it might not be cool to some other people. I think it's cool to be in rheumatology because we can do something for people. Rheumatoid arthritis is being detected earlier now. So primary doctors recognize it when someone says, I'm stiff, I'm swollen, like they see it, they refer early, and the medications that are available these days, can definitely decrease your pain, inflammation, swelling, stiffness, fatigue, and what we call, the goal for us as doctors is remission, because we can actually maybe not cure, but make the symptoms go away, so you don't get this crippling arthritis. I can't even show this to the residents that rotate through my office. You have to open a textbook to see that, because we don't see that anymore. And precision medicine, basically, it's hematologists and oncologists, so cancer doctors do this a lot, where they run basically your genetics profiles, and they're looking at your makeup, whether it's in your joint space or in your blood, and they are detecting what is elevated, what is inflamed, what are the things that are causing trouble in your arthritis, and then you're targeting the therapy, because we have so many options these days. And it's almost like we traditionally start with one, then the next, or whatever our insurance and company tells us to do. But now, once that becomes prime time, we're going to be able to say, you know what, this person is expressing a lot of TNF, or tumor necrosis factor. That's one of the big inflammatory proteins that can attack the joints and cause trouble, versus another person is IL-6. So, maybe another medication would be better for them. So I remember in my training in rheumatology, it's going to date me, but back in over 10 years ago, they were doing this in pediatrics, believe it or not. My pediatric rheumatologist was running profiles and checking, like, IL-6, this, that, the other, and then she would actually target her. I mean, it was a little bit more simple, but she would pick her therapy sometimes based on those profiles, and I'm excited about that, because we can have personalized medicine, number one. Number two, these medications can have side effects, right? So if you're going to do a risk and benefit, you want the benefit to outweigh the risk. So you're going to want to choose something off the bat that you think you have a better chance of putting someone in remission, right? So there are a lot of options, though. So that's nice. Nice way to try to target our therapies.
Great, great. Well, thank you so much, Doctor. Looking on the list here, I think I've covered all the questions, but just let everybody know, if you still have questions, feel free to write them in chat. What will happen is that after the recording is done, we'll go back. Any questions that were not answered, we'll get an answer, and then we'll post it along with the recording online. So it's never too late to ask questions. So thank you so much, Dr. Mehrani. Great information. good stuff. So I'm going to say it's good stuff. So thank you so much. Again, we mentioned in the beginning that we were going to have a drawing, and we've checked our roster, and I'm ready to select a winner. All I'm going to do is give you initials. So there might be more than one person with the same initials, but we will confirm with you via phone or email within the next 48 hours if you have won. Once we do that, you'll have 2 weeks to respond so that we can make arrangements to get the money to you. It is $25 cash. It's not a check, it's not a card, it's actually cash. So the winner for this session here is initials MK. MK. So if you are the person with initials MK, you will probably be getting a call within the next 48 hours to verify everything and then to set up a way to get the money to you. So thank you so much for being a part of the drawing as well for to be here tonight. Just again, we have some more upcoming sessions. Arthritis will be repeated again on the 26th, but in Spanish. So if you are a Spanish speaker or know people who speak Spanish that you think may be interested in this information, please have them come on board on the 26th, same webpage. And then in the month of June, we're going to be discussing Alzheimer's. And we're saying part 2 simply because we've had one session of Alzheimer's, and we're going a little bit deeper in this next one here coming up. But thank you so much for being here tonight and for being part of this. Again, please, I'm going to put back up, before we leave, I'm going to put back up the links for the Arthritis Foundation so you can write it down. Again, this has been recorded and this will be posted within the next week. By next week, it'll be posted at the the station for the YouTube station for MCW, for the Medical College of Wisconsin. Or you can contact us at any of these phone numbers. 414-955-2689 is our main number, and then we can give you the information. Or you can email us at allofus@mcw.edu, and we can send you the link so that way you have it that way. Or again, we are on Facebook, Instagram, and Twitter, and under @allofusmke. And if you want to know more information about the All of Us program here in Wisconsin or nationally, you can join us at joinallofus.org/Wisconsin, and then follow the link to the Medical College of Wisconsin. It'll give you basic information, how to enroll if you want to be part of precision medicine, and how to be part of history. Again, thank you so much. That is our contact information. I'm going to go back really quick here to, here we go. The support hotline, again, for the Arthritis Foundation, 1-800-283-7800, or helpline at arthritis.org. I've been to that website. There's tons of information, very informative, very helpful. So please feel free to go on there. Again, Dr. Mehrani, thank you so much for tonight, for your assistance. Sarah, I know you're listening. Thank you so much also. And have a great evening, everyone. And again, if you have questions, feel free to give us a call. Have a great evening. Stay safe and stay healthy. Good night.
Good night. Thank you, Edwin Kapanda.
Thank you.
Thank you. Have a good night.
You
Night.
too.
Okay.